Okay. Okay, I think we are live right now. Hello, good evening. Good evening to everybody who is watching or will be watching, joining us soon. Welcome to Integrity Icon South Africa's page. Integrity Icon is a campaign of the Accountability Lab South Africa. Accountability Lab is a global nonprofit which essentially aims to empower young people to be active citizens, to create more accountable institutions and responsible leadership in every country, sector, community that it works in. And in South Africa, Accountability Lab's main program thus far has been the Integrity Icon campaign. And essentially what Integrity Icon is about is trying to create positive storytelling around public servants, particularly who work in difficult situations or who work in situations where they are stretched and need to go above and beyond the call of their duty. And so with Integrity Icon, we want to shine a light on those people and hope to eventually create a community of people who are accountable to their work, who do their work with integrity, and who want to serve the communities that they are in. So the point of this Meet the Icon live stream that we're doing today is we want to speak about the campaign that has happened, and we want to just touch base with our icons and as part of helping people to understand what we're doing going forward and getting more nominations for this year. So my name is Hlayisi. I work as a nonprofit management fellow at Accountability Lab South Africa. And essentially, part of my job is just doing anything and everything that has to do with Accountability Lab or nonprofit and learning about how things work. And part of it is getting this campaign going for 2020. So Integrity Icon has been running in South Africa for 2 years. So we have icons from 2018 and from 2019. And today we are going to be speaking to one of the Integrity Icons for 2019, Sakhile Nkosi. So welcome, Sakhile. And just tell us a little bit more about who Sakhile is, where does Sakhile come from, and how Sakhile came into being part of Accountability Lab and Integrity Icon.
Okay, so thank you, Hlayisi, and also I would like to greet the viewers and the listeners at home. And just to give you just a snapshot of who Sakhile is, he is an audiologist at Lydenburg Hospital, which is a public institute. So I qualified in 2016 and I did my community service in 2017 and I remained in the public sector. So now I'm approaching my 4th year in service. So I basically regard myself as a very enthusiastic person, passionate and caring for humanity. So I am involved in various professional platforms that aim to improve hearing healthcare services in South Africa. So Sakhile, he is from Nelspruit in Mpumalanga province, who happened to study in Gauteng and came back to serve in the community in Mpumalanga.
Okay, so tell everybody about a little bit more about what inspired you to study audiology, what happened, a little bit about your journey to where you are now.
Okay, so there are many factors that contributed towards my career choice. And I also think being exposed at a young age to a deaf community member at first hand, which came with its curiosity as to why they use sign language to communicate, drove me to seek answers. And in addition to that, the challenges that the hearing impaired that are facing within our society, such as lack of access to education, makes me want to even And as I was into my undergraduate training at the university, and I was exposed to the reality that there is a scarcity of hearing healthcare professionals in South Africa, and that also illuminated my interest to pursue career in audiology even further.
Okay, wow. So one second. So once you arrived at Lydenburg Hospital, tell us how that experience was, and then so far as well, what have been the highlights of your job? But just first take us back to as you started your internship and how everything went, how you felt in the beginning, and what were the stresses that you saw around you? What were the positives? Yeah, just share a bit more about that.
Okay, so I entered the gate of our institution, which is Lydenburg Hospital 17, and as a community service audiologist. So I was thrown in the deep, and here I thought like I would be being supervised by a senior audiologist who will strengthen my clinical skill. But then I was one of the unfortunate concepts, and I had to build the department from the scratch, but with the help of the and the management. And what I like about the hospital, they did acknowledge that, you know what, we are not trained within your profession, but we're there to assist you whenever you need help. And they connected me with neighboring hospital who helped me to build the department to where it was. So basically the stress out of that was being thrown in the deep at first. Having to build a department without any proper guidance from an audiologist, of whom most community service are are supervised by an audiologist. But then as I was getting more engaged in my job, one of the highlights of my jobs were, I think, the screening of newborns. I think it was a very heartwarming experience at first to perform it as an audiologist, and also relaying the findings to the parents that, you know what, your baby can hear. It's not only exciting to the parents, but it's also exciting to me, and to see that the anxiety that they had about the suspicion of their child, it's now lifted off their shoulders. And also seeing a patient finding joy in being reconnected to hearing sounds that are taken for granted as natural. So here we're talking about sounds of birds or rain. So, but then being able to reconnect them through rehabilitation of using hearing devices, it also warmed my heart. And also seeing patients finding joy in communicating effectively with their loved ones as well. It's also the best highlights of my job.
Wow, that's amazing. So you spoke a bit about how when you first arrived, you were the only person, there was no real leadership. Did you have to come up with a strategy of how you were going to start your work, or was it just on a day-to-day basis that you slowly ended up figuring out how things work? How did you think about there was a specific strategy or initiative that you had to take? How did that work for you?
So basically it was both. So I had to come with it was expected that I should have a document in place of how I want to run the department. So here we're talking about standard operational procedures, of meaning how I perform my clinical work. But then that was done in consultation with the hospital and also other neighboring hospitals who have well-established audiology departments.
Okay, all right. Wow. So basically you just had to learn on the job, and then also learn via finding out or calling people that you knew.
Yes.
And how did what kept you motivated in that time to say that I'm going to continue this job, even though the circumstances are beyond challenging? What kept you motivated during that time?
what kept me motivated, and as I was reflecting as a clinician and looking where I'm placed currently, and I am placed in a catchment area in Mpumalanga where we service a large number of people, and there's only only one audiologist. I mean, my institution, I service 2 hospitals together with their catchment areas and also my catchment.
Wow.
As I am there by myself, if I leave, then who's going to look after the people? So
Yeah.
that's thought in mind that I'm here for a reason.
Yeah.
Despite the challenge.
So we have some comments over here for you, Sakhile. We have Blair, our executive director, who says Sakhile is my hero and integrity icon. He's inspiring, does not let the challenges or circumstances bring him down. So now we can talk a little bit more about the campaign. How did you come across it? How did you hear about it? Who nominated you? What happened when the process started? How did you feel about it? How has it impacted your life? And yeah, anything to do with Integrity Icon.
Okay. So it was in 2019, of time flies, of course, and within my professional network or space, there's Dr. Susan Strauss, who's the past president of the South African Association of Audiologists, who actually nominated me and felt like, I mean, people need to know about the work that I do out there. And she put the nomination and put her reasons why. Then I was contacted by the accountability lab to tell me that someone nominated me. And I went through various process of the nomination, such as I was asked questions about what integrity to me, and I was also guided through the process of the nomination, and up until we came to that stage where we had to do a recording, of which I had to get out of my comfort zone, being on a camera. But at the end of the day, the product, I think, of the filming, really, people responded so well and so positively. It also inspired many people as well. I think also many people are now using it as a tool to also inspire. I mean, high school learners to pursue a career in audiology as well, and it was also used as an advocacy tool to advocate for hearing healthcare services within the public sector and in South Africa in general, and also, I mean, being now an integrity icon, I think it has also informed how I practice on a day-to-day basis as a clinician. I think I became more ethical conscious compared to how I was before. Not saying I wasn't before, but I feel like now I'm more conscious. And also winning this award, it also serves as an affirmation that I'm on the right track. I am a contributor to the society in an effective and efficient way.
Yeah. Okay, so we have some more comments over here. Sylvia Fanyaswald saying, we love you. And Blair has a question. How does Sakhile maintain his integrity even when that is really difficult?
That's actually a question that keeps on coming frequently as I was doing interviews with the accountability lab. And I feel like there is also a biological component, I think, towards that, and also your upbringing as well. So I feel like on my side, speaking from my own personal point of view, it has to also do with the foundation that I got from my parents. So being taught, like, respect people, and being taught, like, treat people as equal, being taught to do the right thing as well. That also, I feel like it informed, like, how I am practicing today, or how I conduct myself today.
And may I just ask on that topic, when you're speaking about, learning values from like a home level and a grassroots level, how do you think it's possible in our society, as people are in their workplaces and stuff, to kind of bring together the values that we've all learned, from our upbringing for the greater good of working with integrity? Do you think that's possible? How, when people's values clash, when, people see integrity as different ways? Have you had that experience in your work? How do you think we can navigate those things as a society?
I think we learn by observation. I mean, by not changing yourself and being consistent, I think it somehow also sort of shift the whole narrative about it. It's sort of so it sort of motivates people, I think, to be people who serve with integrity. And yes, I feel like we learn by observation, being consistent.
Okay. We have some more comments. We have a comment from John Kama. Great work. Keep up the passion and inspiration. Luther, all the way from Nigeria, says, thanks, Sakhile. Keep changing the world one day at a time. We are cheering you from Liberia. Alfred Agu says, only shows that even after upholding integrity as a personal value, the award deepens consciousness of integrity while inspiring others, which is very, very true. And I think the main aim of one of the main aims of integrity icon is that, yes, we want to uplift, or not uplift, but we want to shine a light on how you are doing your work with integrity, but also are hoping that your light shines towards other people as well, who will then be inspired to continue. Another question for you from Blair. What support does Akile need from others to push for integrity? So what support do you need from, I don't know, where you work, or a community, or accountability lab, or from wherever? What support do you need for you to be able to push integrity further?
In terms of activities.
Okay. Do you want to speak more about that?
No, I think workshops. I think that's one support that I will need from integrity icon, and yes, and also screenings as well. I think screenings of these lovely filming of the other integrity icon as also a way of motivating like people, and just to show people that what, there are still people who are serving with integrity in the public sector, despite of the sector being painted as a sector that is not performing well in that part.
Okay, so, and then, we have some more comments. We have a comment from Karabo that says, go Sakhile, Nkosi. And then we have a question from Shirley Erasmus, and the question is there one thing you'd like to change in your sector that you think would strengthen integrity across the sector? So either you can speak in like from health or audiology specifically, but what is a thing that you think you can change that would strengthen integrity in your sector?
I think what I can change, inspiring upcoming clinicians who just entered I'm in the sector or audiology from community level. I think that's where we can catch them at that stage before they get and being exposed to like other ways of doing things, of which really are not in line with integrity. So by changing mindset, perceptions at a very early stage, that's I think what I can be able to change or influence, if I can put it that way.
So obviously we know that we now in the time of dealing with this global pandemic that is coronavirus, and things are changing very quickly in our society. So one of the questions I want to ask you around COVID-19 is, where do you think integrity fits into this? Integrity, accountability, where do you think is the place of that in this pandemic?
Okay, first of all, I can say it just warms my heart to see that the both public and the private sectors are reaching the highest form of collaboration during this pandemic. And I would like to applaud South Africa for that. I think now we at the moment where nobody's thinking about pushing business or money, but it's about helping the people. So Yes, I see equal access to healthcare services. And although there is still ongoing research that seeks to find ways of preventing and managing this complication related to COVID-19, a message that I would also like to leave. I would like to tell people is washing your hands with the soap for 20 seconds, as suggested by experts, it still remains an effective way to prevent COVID-19, and social distancing is also as much as crucial as hand washing. So that's the message that I'd like to leave people about COVID-19. But in terms of fitting integrity into this pandemic is seeing that both sectors are collaborating together and not having not putting monetary value and saying like you are unemployed, so you have to be seen at the state hospital, or you are employed, you have to be seen at the at the private hospital. But we see now more the highest form of collaboration. We're reaching that we are sort of providing people to what the Constitution has set out, which is access to healthcare.
So you would say that integrity fits in now in putting people first and focusing on narrowing the gap in inequality.
Yes.
Okay, all right. Okay, so we have some more questions over here. We have a question from Ode. How have your colleagues perceived you, and how have you been able to influence them to be in the line of integrity?
That's a very interesting one. And I think first obtaining this award, I think I'm more now on the watch. I think there's sort of like two sides to this whole scenario. I think others say like, now you are expected to do exceptionally well. And others, they said, you know what? I mean, you just taught us that you don't need to be a certain important person in order to serve with integrity, in order to be, in order to serve with integrity. So I see that how also I practice, it's sort of like changing people's also ways of practicing and thinking. So that's what a shifting behavior. That's what I've observed.
So that's basically what it practically looks like to kind of, spread the message of integrity. Okay, nice. So then we have another question. So in part of after you became an integrity icon, you also became a member of the South African Association of Audiologists Ethics Committee. So how has that experience been for you, from what you can tell us about it?
It's been actually like an amazing journey, fulfilling journey full of like learning, and also that serving in an ethics committee ties also well with integrity, because you're trying to guide professional and guide also the public towards doing the right thing.
Okay. I think we have some more comments, or there's a comment about our icon. So have you received a lot of feedback from your community and people around, not necessarily just your colleagues?
Yes, from patients mostly. I think some days. So I think Accountability Lab appeared last year on one of the channels. I think it was channel 404, where they were showcasing campaign. I think one of the questions could identify me like at the hospital. I said, no, I saw you somewhere. Or they said you're doing this. Why? And others they said like, but we saw also posters in town about you, because my colleagues were very nice that they've sort of distributed like the posters with the voting lines like across the town. And they said, but why didn't you tell us that you were selected for integrity icon? But yes, the recognition has been overwhelming and also good as well.
Yes. No, that's great. So what would you encourage people? Why would you encourage people to nominate you for integrity icon? Why do you think it's important?
Since Accountability Lab is trying to showcase people who are serving with integrity in a public sector. Public sector in general, it's known as a sector that is not serving with integrity, but within the public sector, there are people who are serving with integrity, whom they deserve recognition, not within their institution, even like from an external source, which is like from organizations such as Accountability Lab. So in order to keep the people motivated and also feel valued and appreciated, such nominations are crucial.
Yes. Wow, well, thank you very much. I think we're almost like reaching the end of our live. I have another question coming up. Does Sakhile have ideas for who should be an icon this year? Does anyone
I have quite a few. Of course, we won't mention names for confidentiality purposes, but yeah, there are a few names that I've put there, and that I'm planning also to put. Yes.
All right.
Oh, of course, there are a lot. But I think at the end of the day, there has to be quite a few that has to be selected. But if then they are not selected, there's still another chance then to be renominated until the world
Nominate them as many times as you want.
Yes, until the world hears their stories. So we have I'm trying to find ways to put it. It's like they are sort of like we have lots of stories to tell and written in different pages. If then we cannot read this page, then we're gonna shift them to another until then.
Yes.
And
all right. Okay, so just a last wrap up of anything as a summary that you want to say about Integrity Icon, about generally the health sector, and then about COVID-19 as well, just to wrap everything up.
So I think now in the world, everyone is panicking about the COVID-19, and I feel like, as I've said, that we are now starting to notice the highest form of collaboration between the public and the private sector in trying to flatten the curve for COVID-19. But also we have to play our part, I think, as society. And one of the tips that I found them useful from the National Institute of Mental Health, which gives us sort of ways of coping with being in isolation or in quarantine, of what we call right now, like being in our own spaces of our house. It's frustrating not to go out, but during this time you can take a break from the news. Make time to unwind and also take care of your body through exercise, through yoga, through meditation, of which I started to implement last week, some of them. And it helps. Like, trust me, now we are on day, I think we are on day, 8 or 9?
Day 8, yes.
8, yes, we are on day, I think I'm a little bit too forward. We are on day 8. I am still coping. And also, it's an opportunity to connect with others as well. Not like, within your family space, and also through social media networks. And also it's time to also set goals and priorities as well. And to also focus on the facts, not on the fake news. So although healthcare workers are essential and they are positioned in the front line, but one must start realizing that the community, they are the front line. So they are tasked with the difficult job of everybody, which is staying at home. And healthcare workers are there at the back to save those who falls in the cracks.
Yes, sure. Wow, no, that's very, very powerful. Okay, so we have another question from Ashmita Sharma. I thought we were going to be wrapping up, but we still have questions. How does your colleagues, superiors, and subordinates react to your initial effort? Do they encourage you? So, from the beginning, how were you feel that you were encouraged in your initial efforts, and then also, I guess, any efforts that you're making now to, do different programs that you want? Do you feel like you're being encouraged?
extremely encouraged from the beginning when I started working. The fact that they acknowledged that, you know what, we might not be trained in your profession, but we are here to support you. I think that speaks volumes about them. And
Yes.
also, like when I obtained the award, and also hearing phrases such as "We are proud of you. You're such an exemplary in our institution." That's also
Yes.
to me a form of support. Yes, I
Yes.
am extremely supported. Mm.
That's great. And okay, we have another comment from Baktawa. Baktawa saying, great work, keep it up. And then we will speak a little bit later about how people can nominate for Integrity Icon. But you spoke a bit about mental health, and I think that's something that's very important to highlight with COVID-19, because we're going to be indoors, and a lot of the time people's, situations of living of yeah, their living situations or home situations are very different,
That's
and those
different.
can impact on mental health. So you've mentioned some of the methods, but are there any ways that there are specific helplines or things that people can reach out to if they are feeling like they are overwhelmed by situations?
There are a lot and lot, although I cannot recall them off by head. But if you can
Yes.
navigate through the National Department of Health line, you will find a lot and lots of lines that actually help you. If, let's say, you are experiencing depression as a result of this COVID-19, or you are experiencing like abuse, because now some people like you said, people situation of living are very different. So you might
Yes.
find some like they are prone to abuse during this time because they are
Yes.
more isolated from the community. They are within their space, of which before, when we didn't face the situation, going to work was sort of like a relief for them. So there are
Yes.
also lines to help people who are experiencing such form of abuse. And yeah, there's lots of support out there that is in
Yeah.
place,
So
of which
if
I can share at a later stage, then you can share towards your platform.
Yes, no, we'll definitely share. But we've been sending out bulletins as well. We on our pages daily,
Mm.
and those will have numbers of designated hospitals as well as
Mm.
important numbers that you can contact. So if anybody is looking to receive any help, they can also have a look at our posts, and we have all of that information up. So thank you very much, Sakhile, for taking time out to speak to us today. I think this has been very helpful and fruitful. Seems like there's a new comment. Let me quickly add another comment from Gibo. Gibo says, hi, Sakhile. I've always been really inspired by how you're a young person who doesn't let difficult circumstances stop you from making an impact. What advice would you give to young people working in difficult circumstances who sometimes feel discouraged about not getting the support that they want or need? So people who don't necessarily get support to be able to, push the things that they want to push.
I think one advice that I can give is reflection. Like you have to just sit back and say, if then I was in here, I mean, what would have happened? What would have felt?
Yeah.
What would have still continued? I think for me, reflection helps a lot,
Yes.
because once you reflect and you start finding the answers, like why am I here, then that sort of like, I mean, that sort of motivates you, and that also sort of push you to move forward.
Yeah.
Mm.
So at your core, understanding why you do what you do, and that gives
Yeah.
you the answer to keep you moving forward.
Yes.
Okay, well, I think we could go on and on and on, and we could talk for a very long time. But I think that wraps up very much what we wanted to get out of this Meet the Icon. So thank you very much, Sakhile, for joining us. Just a word about our nominations. We're going to be looking for more icons and more amazing people like Sakhile to honor this year. And the ways in which you can send in your nominations is you can go to our website. It's integrityicon.org/South Africa or South-Africa. Or you can WhatsApp us. We have a WhatsApp number where you can just say hi on that number, and instructions will come up. And that number is 060 080 6146. That's 060 080 6146. So please do use those channels, and think of people that you know who work in health, who work in education, who work in justice, anybody who stands out as being someone who has worked with integrity and with honesty despite the environment, not necessarily following the same tune. But thank you very much for being a great example of what public servants are supposed to be, Sakhile, and keep up the great work and keep doing your best when no one's watching, because that's the key of what integrity is about. Thank you so much.
Thanks.
And thank you to everybody who's watched and everybody who hopefully watched this video. It will be up on our Facebook. If you haven't already liked our page, please like our page, and check out the work that we do on Twitter and on Instagram as well, and at accountabilitylab.org, integrityicon.org, and send in your nominations for any public servants that you know. Okay, I think that's the end of our live. Thank you once again. I think I said thank you like 20 times. And hope you have a good weekend. And remember, wash your hands, everyone. Wash your hands.
For 20 seconds.
For 20 seconds, 20 seconds. Keep the social. Don't break lockdown rules. All right. Thank you so much, then.
Thank you.
Bye. Good night.